We're pulling out all the stops, whatever it takes, even if we get trusted community people, trusted messengers in the community to go house by house, person by person.
All right, that was Dr. Fauci. He spent the last few days on a left-wing media tour, doubling, tripling, and frankly, quadrupling down on the president's door-to-door vaccine push. But that's not all. If door-to-door knocking wasn't enough, and we've talked about that before, these so-called trusted messengers may be coming for your cell phone. That's right. According to Politico, the DNC is considering fact checkers who will work with SMS carriers to dispel so-called misinformation via text messages. Here with reaction, Kentucky Senator and Dr. Rand Paul. Senator, always good to see you.
Great to be with you.
All right, so the administration wants to reach all these Americans at their doorstep, and now they're talking about through using text messages to push this vaccine agenda. Are you concerned that this is a slippery slope that we're going down in terms of the government coming to your life, coming to your house to push an agenda, a message, a policy?
You know, I think if we want to start by dispelling misinformation, we should start with Dr. Fauci. Most of the pressure here for vaccinating children comes from him not accepting the science of natural immunology and natural immune reactions. About 100 million Americans have gotten COVID, even by the conservative count of the CDC. So those people have immunity. If you add those people to those who've been vaccinated, we are at herd immunity now. If you look at the data, the day-to-day data, the daily incidence has gone down dramatically and the death rate has plummeted. So really, we should look at the science, but because Dr. Fauci ignores the science of natural immunity, he presses on. And because he has no respect for freedom, for individual freedom, he wants to push on to tell us and mandate what we must do in our medical lives. And so I think this is a terrible step backwards, and it's ignoring the science, frankly.
Well, Biden has said that he would support local vaccine mandates. He wouldn't put it at the federal level, but supports the local level. It's interesting, though, because in some Democratic-led states, we're seeing these mandates continue despite, as you're saying, that we're reaching more of a herd immunity. Even California's Department of Health has announced that kids will be required to wear a mask or a face shield indoors, and New York has similar mandates as well. But to your point, Senator, how is this following the science? Democrats like to say that we follow the science, but then when it comes to it, they're just not.
Well, you know, I have one basic scientific question that I think they have the data for and they should release. The incidence of myocarditis in young people getting the vaccine, is it higher among children who have already had COVID, who they're pushing on the vaccine on kids who have already had the disease? There are reports that if you've already had the disease and you get the vaccine, you get 1,000 times greater response. Is this associated with the increase in side effects, people who have already had the disease? If so, we have a very easy way to put parents at rest, and this would be, being honest with parents, might encourage more to get vaccinated. Let your child come in, and if you're uncertain of the vaccine, let them be tested for antibodies. And if they don't have antibodies, you'll be more assured that maybe they won't get this reaction. But we can't even get to the truth of that because the CDC and Dr. Fauci and NIH, they don't care whether you've had it. They don't care what the side effects come from. They don't care what the side effects are. They want to sweep it all under the rug, and you're just not supposed to worry your pretty little head about it. You're supposed to stick your head in the sand and do as you're told. Be a good boy, be a good girl, be part of the collective. But they don't want you to think about your own health care. So this is the wrong way to go about it. But by using a heavy hand and threatening us, guess what? It causes more resistance. People who like their freedom, react in the opposite way when you try to force us to do something, particularly if you're not going to really obey the science yourself.
Dr. Paul, I want to ask you to pick up on this theme of kids, because in some cases we're just about a month away from some school districts around the country having kids return. And if not a month, then a month and a half or so, right? And as I understand it, and correct me if I'm wrong, that this vaccine, these 3 vaccines, are still approved only on an emergency use basis. Specifically because, as I understand it, we don't have the long-term data that would get them approved on a permanent basis. So let's say that you are a parent, and the elementary or nursery school that your child is attending or will attend this fall is saying that you need to have your child vaccinated. as a doctor, as a medical professional, would you recommend that parents go ahead and do this, or should they somehow still be concerned about the long-term effects that this might have on the development of a child in, say, 5, 10, 15 years?
I think it's unknown for children. If you're over 65, to me, it's pretty clear that the risks of the vaccine are much smaller than the disease. If you're under 25, the opposite is true. The risks of the disease are so small that we really need to examine the vaccine and make sure that it's less risky to take the vaccine than to get the disease. Right now, if you're a school age, let's say kindergarten through 8th grade, the seasonal flu is more dangerous than COVID. It just frankly is. This is the truth, and they're not telling us the truth. This disease, COVID-19, is very dangerous after a certain age and not very dangerous under a certain age. But
Senator, let me ask you. But what I'm trying to get at is, explain to me as a medical professional, should a parent be concerned that a school is asking them to vaccinate their child before a vaccine is given full use? And while it is still in this experimental phase, should that be a concern of a parent?
Yes, and the other thing is that the law has dictated in the past that you can't mandate things that are experimental. So I think what's going to happen is the FDA in rapid fashion is going to approve it. They are going to mandate it, and your only choice is, do you have enough money or time to try to escape the government schools? And so, look, I'm not against vaccines, but I am against mandates. It should be your choice. And there really should be some investigation of whether or not we're having a higher degree of side effects in kids who have already had COVID by inoculating them. There is no science behind giving an inoculation to someone who's already had it, particularly a child. It goes against the science. And if they're not willing to tell us whether the side effects are greater when you vaccinate a child who's already previously had COVID, if they're not going to be honest with us, then I probably would say, hey, this is not for me. But ultimately, this is about freedom and medical choice. Individuals and parents in a free country decide, not the government.
Senator, we don't have a ton of time left. I just want you to answer this real quick. We let in with this sod of Dr. Fauci on another left-wing network. He spends a ton of time on CNN, MSNBC. We've asked him to come on this program for 91 days. He has not done that. He has not responded. Is it appropriate for a nonpartisan government bureaucrat to only cater to left-wing media on a public health issue?
I think Dr. Fauci is the ultimate elitist. He does not want to engage in debate that includes both sides. He does not want any individual to think about their health care. He wants everyone to blindly submit. He frankly thinks that Americans aren't smart enough to make his decision. So my guess is he would be afraid to encounter a Newsmax audience that is a thinking audience.
I agree. Senator Rand Paul, Dr. Rand Paul, thank you as always for coming on and breaking this down.
Absolutely.